The Children's Bureau funded the Building Evidence Training (BET) project to develop the capacity of child welfare staff to support evidence building and strengthen the field's ability to design and implement effective practices. The first BET course, Evidence Building Strategies in Child Welfare, prepares staff to apply practical strategies to support evidence building. The second, Designing and Implementing Evidence-Supported Interventions in Child Welfare, demonstrates how staff can participate in intervention development, adaptation, and implementation processes. Together, these courses help prepare current and future frontline child welfare staff to build evidence for the field and support the successful implementation of evidence-supported interventions that will improve outcomes for children, youth, and families. We invite you to integrate the BET courses in your training programs and curricula.
My name is Jennifer Kelman, and I'm a clinical assistant professor and the director of the Child Welfare Academy, which is housed under the umbrella of the Institute for Innovation and Implementation at the University of Maryland School of Social Work. In the field of child welfare, there has historically been a lack of evidence and research about what services, interventions, and supports will positively influence outcomes for children, youth, and families. I think child welfare agencies are becoming increasingly more aware of the need to dedicate what limited resources they have to programs and practices that have demonstrated effectiveness.
Evidence-building strategies in child welfare builds practical knowledge and skills that will allow frontline staff to participate actively and effectively in evidence-building activities. Course participants learn what is meant by evidence-supported interventions and evidence-based practice, practical information about how to build evidence, and their roles in building evidence by participating in continuous quality improvement (CQI) processes, research studies, and program evaluation.
My name is Amy White, and I'm the Child Welfare Professional Enhancement Program Specialist and Faculty Field Liaison at the School of Social Work at the University of Oklahoma in Tulsa. For several years, I've been working with child welfare employees who are obtaining their Master of Social Work. I was searching for a training that provided a foundation on the importance of evidence-based and evidence-informed practice in the field of child welfare, and this course fit this need perfectly.
Participants in BET's second course, Designing and Implementing Evidence-Supported Interventions in Child Welfare, learn why interventions must be well implemented to be effective, why teams with diverse expertise and perspectives are critical to successful implementation, how to use a stage-based framework to guide implementation processes, and how agencies evaluate the effectiveness of interventions and plan for sustainability.
Choosing a practice or intervention that is supported by evidence is an important step, but that does not ensure that desired outcomes will follow. In order to achieve positive outcomes for children, youth, and families, attention must also be paid to how interventions are implemented. This course provides frontline workers with the knowledge and skills they need to understand the major stages of the implementation process and how to use an implementation framework to guide intervention selection, the development, adaptation, and implementation processes.
This course helps child welfare professionals to understand the connection between developing and implementing evidence-supported interventions and achieving positive outcomes for children and families.
Each course features 6 interactive e-learning modules with child welfare scenarios, printable reference briefs and resources to support the modules, and pre- and post-tests to assess knowledge gains.
Transfer of learning exercises for each unit ask participants to apply course concepts to practical child welfare situations. Participants can complete the exercises independently or as a group. In my training, these activities led to valuable discussions where I could tell students were really understanding the concepts.
The flexibility and design of the BET course allowed the Child Welfare Academy to offer it as an asynchronous, standalone course that workers could complete independently at their own pace, while still receiving feedback, support, and guidance from me as the instructor as they moved through each unit. This made the course easily accessible for those who might otherwise have been unable to fully commit and participate in the course. One of the greatest benefits to my students has been the realization that they, as frontline workers, play a really critical role in the successful implementation of interventions that will support safety, permanency, and well-being outcomes for children, youth, and families. Frontline workers now seem to better understand that their voice and work is important and that they can contribute in positive, meaningful ways as members of implementation teams.
The course highlights the critical role frontline workers and supervisors play in implementation processes. It's an excellent course for child welfare agencies to prepare staff to implement major initiatives through team structures.
Students have shared that they appreciate the ability to participate in the course virtually and to move at their own pace. They find the course easy to access and navigate, and the content to be informative and highly relevant to their work.
My students told me that they found this training to be useful, not only for their practicum, but also for their jobs. One student explained that she'd been assigned to look at possible interventions for youth with substance abuse, and this training gave her a better idea of what to look for and how to conduct the research. BET courses will fit well in social work courses, especially child welfare, methods, policy, research, and programs and intervention courses. They would also work well integrated into training for new and experienced child welfare employees.
I would highly recommend that administrators of child welfare training programs consider integrating the BET courses into their course offerings for both frontline workers and supervisors, and that workers and supervisors take advantage of the opportunity to participate in the courses. The content is particularly timely and relevant for states and local departments that may be in the process of adopting a new intervention or a new service model.
Each BET course has been approved by the National Association of Social Workers for 8 continuing education units. Visit the Children's Bureau's virtual learning site, CapLearn, at learn.childwelfare.gov to access the BET courses, Evidence-Building Strategies in Child Welfare, and Designing and Implementing Evidence-Supported Interventions in Child Welfare. This product was created under JBS International Incorporated, contract number HHSP 23320150074I/HHSP 23337003T, funded by the Children's Bureau, Administration for Children and Families, U.S. Department of Health and Human Services, and does not necessarily reflect its views.